So we have these health insurance companies. They have proven decade after decade they don't deserve to fund our health care system through our premiums because they make more money by denying claims. They have 30% of the dollars administrative, corporate expenses and salaries. Aetna is up to 30%. Medicare is 3% administrative costs. So we're talking about full Medicare for all, free choice of doctor and hospital. If you're part of an HMO, they assign you the doctor and hospital. Getting rid of $500 billion of corporate bureaucratic expenses, including $220 billion is the estimate of computerized billing fraud and abuse. I just imagine that figure. 220 billion, where did I get it from? Never let me say a fact that you don't ask me, where did I get it from? Where did I get it from? The Government Accounting Office of the U.S. Congress said 10% of the entire health care bill is drained away by computerized billing, fraud, and abuse. They have all these different codes, you know, for the various procedures that they manipulate. They're consulting firms that show hospitals and doctor practice how to operate. $220 billion. Well, if you have a single payer, it doesn't happen. You have 1,500 payers and cross reimbursements, and that's where the trouble starts. If you have a single payer, the government insurance with private delivery, let's say, if you have a single payer, I would prefer health co-ops, but that's down the line, community health co-ops. But if you have a single payer, you can have better outcome analysis from the data, because you assemble the data. That's why the VA, for all the criticism it's getting, has the most modern outcomes data analysis system in the United States. And they can tell when operations aren't working, certain drug prescriptions aren't working. So it's a preventive health care insurance system, full Medicare for all. Right now, Medicare is being perforated, undermined, sucked away under Medicare Advantage with 12% taxpayer subsidy so that the companies can undermine Medicare. Democrats went along with that. Democrats did not stop the drug benefit bill, which prevented Uncle Sam from negotiating for volume discounts for drugs that end up for elderly people who can't afford it. Can you imagine? The big consumer is handcuffed. Even though old laws allow the Defense Department, the VA, to negotiate volume discounts, the Democrats went along with the Republicans. The Democrats, when they're in charge, do what the corporations want. When they're not in charge, they don't stop the Republicans who are in charge, who do what the corporations want. Now, if you can perceive a difference from that, you're producing strips of mica. Would Gore have invaded Iraq? No. A crazy pit bull wouldn't have invaded Iraq. But the Democrats could have stopped Bush from doing so. Would Gore and Clinton have imposed sanctions on the country of Iraq, which took 500,000 children's lives in the 90s? That's what they did. American Task Force of Physicians documented that again and again. You might have seen Leslie Stahl on 60 Minutes on that one when she asked Madeleine Albright, Secretary of State, is this worth it? She said, Mr. Secretary Albright. She said, yes, it's worth it. It didn't bother Saddam. I mean, he doesn't care about child catheters. He doesn't care that there wasn't chlorine exported because it was prohibited to clean the drinking water, led to diarrhea and dysentery among poor Iraqi kids. He's got his own little bubble of nice food and water. This is an international crime. Sanctions that damage, kill, injure, sicken civilians in another country is an international crime. And those